Good morning and good afternoon, everyone. Thank you for joining us. Welcome to our webinar, Health Implications of Anti-LGBTQI+ Stigma and Discrimination, a Spotlight on Uganda. My name is Louise Ivers. I'm the Faculty Director of the Harvard Global Health Institute and Executive Director of Massachusetts General Hospital's Center for Global Health, and a professor of global health and social medicine at Harvard Medical School. We have partnered on this webinar to address Uganda's recent passing of the Anti-Homosexuality Act 2023, an outrageously harsh anti-LGBTQI+ law, which I know has already had negative health impacts on the community and will have impacts on all Ugandans. Our panel of experts will draw from health data and evidence, as well as personal experience, to highlight the direct health impacts of legislation of this kind and what it has on the community, the LGBTQI+ community, and the significant setbacks it poses to the HIV response. Before we get started with the conversation, I have a couple of notes. The session is being streamed and it is being recorded through Zoom. The recording will be made available on the HGHI YouTube page afterwards. We are hoping to incorporate your questions. So if you have questions from the audience, please use the Ask a Question feature on the bottom of your screen, and we will do our best to get to those in the Q&A portion. With that, allow me to introduce you to our speakers today. Frank Mugisha has been called to an urgent meeting, so he's unable to join us for the beginning of the discussion, but we are still hoping he will come as soon as he can, so I will introduce him. Frank is a Ugandan LGBT advocate and the executive director of Sexual Minorities Uganda. In 2004, he founded Icebreakers Uganda, an organizational support network for LGBT Ugandans that now sits within the SMUG organization. Mugisha is one of the most prominent advocates for LGBT rights in Uganda, and he's received numerous awards, including the RFK Human Rights Award, the Thorolf Rafto Memorial Prize for his work, and last week, Frank won the 2023 Freedom Award from the Rainbow Railroad, awarded in Canada. Richard Lusimbo is with us, the founder and the Director General of the Uganda Key Populations Consortium, UKPC. Richard is an extremely well-known and highly respected LGBTIQ and human rights activist across the African continent, hailing from Uganda. He began his activism there in his early 20s and has been a trailblazer for young leadership in Uganda and beyond. Richard holds a Bachelor of Information Technology degree and a Master of Philosophy in Human Rights and Democratization in Africa. He's a passionate advocate for marginalized community voices to be present in policy, laws, national frameworks, working groups, committees, and all spaces where their human rights and health issues are discussed and documented. Before founding UKPC, Richard worked as the Research and Documentation Manager at Sexual Minorities Uganda and was a Program Manager at Pan-Africa ILGA. Richard is currently one of the co-conveners of Convening for Equality, a movement charged with fighting the Anti-Homosexuality Act of 2023. He also sits on numerous boards, governance spaces, and technical working groups at national and global level. Kenneth Mwihangwe is Executive Director of the Coalition for Health Promotion and Social Development Uganda, known as HEPS Uganda. He has years of experience in health promotion and advocacy. He's worked with both grassroots communities and national level stakeholders in promoting health and the rights of people living with HIV in Uganda. Kenneth also currently coordinates the Uganda Coalition for Access to Essential Medicines, which spearheads advocacy campaigns to increase access to medicine with a special focus on antiretroviral therapy for HIV. Kenneth has a bachelor's degree in social science and a master's degree in social sector planning and management. Jennifer Leaning is a senior fellow at the Harvard FXB Center and professor of the practice at Harvard Chan School of Public Health. An associate professor of medicine at Harvard Medical School, she's a faculty member in the Department of Emergency Medicine at Brigham and Women's Hospital in Boston. She served as the director of the Harvard FXB from 2010 until 2018. Dr. Leaning previously served as co-director for the Harvard Humanitarian Initiative and director of the Program on Humanitarian Crises and Human Rights at the Harvard FXB. She has experience all over the world in public health issues and the violations of human rights in a range of crisis situations. Her work has focused over the last 30 years on identifying violations of human rights and international human law. She is the author of a 2015 report on the atrocities, including persecution and other crimes against humanity against LGBTI Ugandans. And lastly, our moderator, Dr. Ingrid Katz, is the Associate Faculty Director of the Harvard Global Health Institute, Associate Professor of Medicine at Harvard Medical School, and Associate Physician at Brigham and Women's Hospital. Dr. Katz has spent the past decade focused on developing socio-behavioral interventions aimed at improving care for the most underserved in low-resource settings, primarily in South Africa. She is the recipient of numerous awards, including the Dean's Award for Emerging Leader in Women's Careers by the Joint Committee on the Status of Women in recognition of her work advancing women's careers at Harvard Medical School. Dr. Katz, please take it away. Thank you.
Thank you so much, Louise. I'm honored to be here today with our colleagues from Uganda and from Boston. And I just want to acknowledge the incredible bravery of our colleagues here from Uganda. This is a very challenging time for them, and I want to recognize what they're doing in this moment. So I think what we should do is start with really a discussion about this law. It's called the AHA, the Anti-Homosexuality Act. And there's been a long history of discrimination and prior criminalization of the LGBTQI+ community in Uganda. But this law, as it stands on the books, is truly one of the most regressive in the world. And I'd like to start with you, Richard, and really would love to hear from you about your thoughts around the origins of this law, its current status, and the overview as it stands now, as it has been enacted by the president.
Thank you so much, Ingrid. I also want to take this opportunity to thank Louise for an excellent introduction for all of us. And also want to thank everyone who has taken time to join us this morning and evening and afternoon, wherever you're joining from. The law that we face now, the Anti-Homosexuality Act 2023, is not new to Uganda, but as early as 2009, we had the very first tabling in Parliament, the Anti-Homosexuality Act, which was commonly known as the Kill the Gays Bill in 2009, and then it was passed by Parliament in 2013, and then signed into law in 2014. But the Constitutional Court nullified the act in August that same very year. So close it almost 10 years later, we are again back at the same level and discussion. But again, we find ourselves with one of the most dangerous anti-LGBT legislation in the world, whereby LGBT people are criminalized to the extent that even accessing services will be very difficult. But before I get into that, I just want to say a little bit where did all this start from? We have seen the role of American evangelicals that they have played in pushing for such legislation in my country, Uganda, and other parts of Africa. I'll give an example of an American evangelical, Scott Lively, who started coming to Uganda in 2002, and he started meeting our political leaders and members of parliament, and later on even supported in the drafting of the very first anti-homosexuality bill. And this really shows you the kind of role and commitment that the American evangelicals have been playing in pushing for legislation that criminalize LGBT people. Just towards the end of March, we had Sharon Slater, the head of Family Watch International, who was in Uganda at the same time when there were discussions of the law that had been sent to the president. And the reason why she was in the country was to bring other anti-LGBT activists, but also bring other members of parliament from across Africa in what was termed as discussing family values, African family values. Now, you can imagine that we are having a leader of an American organization coming to lecture our leaders on African family values. So again, we see the role that they played in pushing, and of course, Sharon Slater's record on pushing for such legislation has not been covered up. It's well known. We are seeing the same in Kenya. We are seeing the same in Ghana and other parts of Africa, and they seem to be having kind of a template that is being followed. So we find ourselves with a very draconian law that has in a way been pushed by American evangelists. And again, of course, with our own leaders who are using the populist propaganda to ensure that they win votes, but also show that they are working. So they push for this legislation, but what they have done is actually alienate us as LGBT Ugandans.
Thank you, Richard. I'd love to hear from you. How are you seeing this playing out right now, particularly for the health and wellness of the LGBTQI community? And is that also trickling out into other communities in Uganda?
Yeah, thanks so much, Ingrid. And again, I must state that HIV prevalence among LGBT community is high, and this is why in HIV response, we are among the key populations. When you look at the current studies that have started, if you look at the current survey, which put men who have sex with men or by men or gay men at around 12%, which is even more higher. It's double digit for the general population. So this really shows you the kind of danger that we are dealing with. And it's the same for trans community members who are even more at risk. And these are the issues that really why, as advocates, we've been really discussing and saying this law is actually going to be pushing the community even at more riskier ways. One of the things that this law is already impacting on the communities is the mental health risk for our community, because now we already been facing risk because of who we are, but now with this law, the mental health issues due to societal prejudices and discrimination, this legislation is potentially increasing levels of anxiety, depression, but also this could also push our community members into even fear and even more marginalization, because the fact that they can't even trust community, they can't trust even their own families because of the whole issue around reporting, the whole issue around promotion. But also, let's talk about the physical health risks. The Act, again, is going to, or is already deterring members of the community from seeking healthcare services due to fear of being identified and arrested and persecuted. And this is not something that is new to my community, where we have seen offices raided, where we have seen peer educators are arrested, and currently we even have 6 peer educators who continue to be held in jail, and yet all they did was carrying out promotion of health services and providing more information to their peers around condom use, around lubricants. But the fact that, again, having even lubricant becomes a risk, this is again something that is going to hinder even our service provision, but also access to services, because things like prevention are already at risk, just the same as treatment and care. The other is around the incubation of public health initiatives. This law, again, is going to impact, and we're already seeing this, whereby initiatives targeting the communities, partners are rethinking twice. Do we have to give these services? Do we have to provide HIV prevention and treatment? Because people are afraid of persecution. And again, because of this, we are going to see people fearing to start up initiatives that are targeting the community or even reaching out to community, but also the community will be afraid because they don't want to be identified. And again, this puts our community even at more risk. But again, I must also say that the impact on healthcare providers, because right now, when you look at the Act, it's very broad and very vague when it talks about promotion. So does providing a service to an LGBTI person qualify as promotion? And of course, promotion, you end up in jail. So again, this is creating a lot of second thinking and hesitation among service providers because they do not want to be suspected to be part of the LGBT community, but also the community is afraid to be also be implicated to going to access the services, but also the providers are like, they do not want to be associated or be seen as people who are promoting or engaging in amplifying the voices of the LGBT community. The other thing that I will also speak to in terms of access to health services is the increased stigma and discrimination. We've been dealing with a lot of stigma and discrimination when providing services around prevention, care. But what this law again is going to do is that it's going to really push increased levels of stigma and discrimination because the Act reinforces and legalizes discrimination, which can lead to an increase in hate crimes, bullying, and violence against the LGBT community. And such negative social environments have been linked with various health problems and increased mortality. But I also want to say lastly around this issue is that there could be, and there's going to be a spillover effect on other marginalized groups because again, first of all, people will be afraid to provide services, let's say, to the LGBT community. But what this also does is that they could be pushing for other legislation that could other target other marginalized groups. For example, people who inject and use drugs, the harm reduction programs will greatly be impacted. Sex workers, again, these programs also be targeted, but also generally the people living with HIV, the fact that there is discussions around the fear, are they going to cut aid or they're not going to cut aid? So again, these are some of the things that are really impacting. And I must say that even the media is already reporting and indicating that for recently, a whole clinic within Kampala that has seen a reduction in members of the community coming for services by 60%. And this is just a facility that we are looking at, and there could be even more. And as time goes by, we're going to see that the negative impact is really high. And this is why, as advocates, we've been pushing and trying to communicate that this is a law that we do not need. Thank you so much.
Thank you, Richard. I think there's so many things to unpack there. I mean, one of the things that is deeply concerning is the chilling effect that you discuss on providers. And certainly when you are hearing of colleagues getting arrested, that's terrifying as a healthcare provider. I think the other thing that you bring up that I'd love to ask Kenneth is around partnerships, because we know that the US is a big partner in development in public health with Uganda. We know that PEPFAR, which is the President's Emergency Plan for AIDS Relief, had allocated $400 million to Uganda in 2022. So there's a lot of public health investment from the United States in Uganda right now. Most of the investment actually that comes from the United States is in public health. And I wonder, Kenneth, if you could speak to how this law is affecting these partnerships, and if there are any concerns in Uganda about these public health programs.
Thank you so much, Ingrid. Good morning, good afternoon, good evening from wherever you're logged in. So about partnerships, and I'm glad that you start with PEPFAR, which is our biggest according to our national aid spending assessment done by the Uganda AIDS Commission. It indicates that about 80% of our HIV response is funded by donors, and in particular, PEPFAR being the biggest. I think we've been recipients since 2003 when Bush George Bush announced the PEPFAR program. And since then, Uganda has been a beneficiary of this program where millions of lives have been saved. And this partnership now is in jeopardy because one of the core principles is non-discrimination. And we're also at a time when we're talking of a transition. There've been introduction of government-to-government partnerships where PEPFAR is transitioning its funding through government systems or regional referral systems. However, all this now is in jeopardy. We're also seeing the routine routine engagement platforms are now not as regular as they were, where the different AIDS development partners sit and share progress, but also plans on who is doing what where. Since the signing or introduction of this bill, we've seen that that consistency is no longer there. And also we've seen strong statements by the US government over this law and what's at stake. I think Richard clearly demonstrated the impact of this on the community. And this is as well a very, very big challenge currently for not only the US government, but also other development partners like the Global Fund, which also funds a lot of our treatment or commodities for ARVs. And again, also standing on same principles of non-discrimination of anyone, despite of their gender or sexual orientation. And all these we are seeing, they've put out very, very strong statements. But also we are seeing, according to the UNAIDS status update report, where we see 70% of the new infections are among the LGBTI and key populations. And remember, these are only about 5% of the global population, but you can see the very high infections among them. And this, as Ugandan, we've taken on a multi-sectoral approach coordinated by the Uganda AIDS Commission, which coordinates these partnerships by different development partners, since HIV needs a multi-sectoral approach. However, we are seeing with this law, which is a legal instrument now, as Richard has stated, it's challenging to operate in such environment. There is a lot at stake in terms of donors committing to the response. There is a lot of anxiety as well among the recipients of these services.
Thank you, Kenneth. I might follow up with one more question really in this vein, which is, you know, as an activist, as you are in the community, are there things that you would want people to be knowing? Because I think it can be complex when governments are invested in other countries in big public health programs. And simultaneously, as you said, there are groups that are highly coordinated that are trying to provide services for the LGBTQI community. Are there certain things that you would want others outside of Uganda to know about those programs and ways that people are supporting those programs, either within the country or outside of Uganda?
Yeah, so we have different delivery models to reach out to these highly stigmatized populations. We have what we call drop-in centers, which are specialized clinics that offer specialized services for the LGBTI community. However, as Richard has stated, one of them where we've seen very perturbing statistics, where we've seen a drop of about 60% in utilization of services. And this actually, since the debates on the bill started, we saw drops in utilization of these services. And according to the Stigma Index done by the National Forum for People Living with HIV, the LGBTI community faces double the stigma that the ordinary people living with HIV face. And this shows how now complicated it's going to be to reach out to these communities. We still have about 200,000 people undiagnosed, and these are communities that are highly stigmatized. In Uganda, we have about 1.4 million people living with HIV, about 1.2 million are known, and about 95% of those are on treatment. However, those that are remaining are the highly stigmatized populations. And it's very, very complex reaching them, given even ordinarily without this law, because of the stigma associated with being in the LGBTI community. Now with the law, it's even worse than that. And even what we've thought hard to put in place to reach those communities, to create an enabling environment, I think is now more at stake. Even the providers themselves, Richard has mentioned some of the peer providers, and these are people that are from the community that are oriented on delivering these services. However, now with this law, we are seeing they're being apprehended, and that's making the situation more difficult to operate.
Thank you so much, Kenneth. I mean, I think the point you raise is so critical, which is when one group is targeted, it codifies systemic discrimination. And ultimately, it leads to an erosion of human rights. And that, of course, leads me to you, Jennifer, who is our expert in human rights and has been involved in this work for a very long time. I would be grateful if you could speak to the trajectory of what we're seeing in Uganda and the work that you've done there to help us perhaps understand the context of this particular moment.
Well, thank you very much, Louise and Ingrid, for organizing and hosting this event, and a warm welcome to all who were able to be part of this community of listeners. And it's a privilege to be in a discussion with Richard and Kenneth in terms of their courageous and expert support of the LGBTIQ community in Uganda, stretching back years. My involvement began when I was asked to look at what was happening in Uganda in relation to the gay community under the influence of Scott Lively, whom you've heard about. Richard mentioned him, who is a evangelical minister and preacher who from the early 2000s on has been whipping up hostility towards the community and framing the influence of LGBTQI people as an assault on the African family and the fundamentals of values that a devout Ugandan community, whether they're Catholic or Protestant, just sort of reaching out to the Christian community in Uganda, which is large, and saying that not explicitly mentioning AIDS, but creating a poisonous atmosphere that people from this community are at high, putting the rest of the population at high risk, are doing evil things from the standpoint of religious doctrine, are polluting the community, that is the African community, and must be resisted and dealt with in very definitive ways, which he doesn't specify, but he gives permission to a large number of invasive investigations and hauling people from the streets and denying them healthcare through his rhetoric. He has really been influential. And this was a long report that I wrote documenting his influence in the public space. This was looking at the ways in which newspapers are very effective in spilling out his campaigns of hate and identifying people who were gay, bisexual, trans, and the impact on their lives, which couldn't be directly linked to his rhetoric and organizing, and the newspapers and media that were outing people with pictures and calling on the agencies of government, the police in particular, to do something about these people who were polluting the public order and undermining the family and tricking children to become gay. I mean, the rhetoric was really extraordinarily foul. Okay. And so Sexual Minorities Uganda, SMUG, which has already been brought up here, it asked the Center for Constitutional Rights based in the United States to develop a brief against Lively. At least it was a joint process, the Center for Constitutional Rights and SMUG. And they asked me to provide an expert witness document. So I looked at this very carefully and used a framework of crimes against humanity and actually the Genocide Convention for the legal categories of incitement and the ways in which risk to a community could be narrowed down to the point where their very lives were in grave jeopardy. And there was abundant evidence about people fleeing, about people being deeply abused and assaulted whenever they were brought into custody, of people being raped on the streets on the basis of just suspicion. In other words, this hatred fueled by fear of the dissolution of the Ugandan community resulted in jeopardy that was very widespread, didn't have to be set by the police or by the legal authorities. It had diffused through the ordinary vigilante aspect of Ugandan society. Mobs were, small mobs and big mobs could be mobilized and were being mobilized against the gay community. So this is in the context that I wrote this 2014 report. And it, the judge who looked at the suit against Scott Lively said it was a great suit, that he understood the premises, he understood what was going on in Uganda. The problem was that we didn't have standing to sue in the US courts because the we were not sufficiently part of the injured parties, the CCR. So that was it. But fortunately, the law, the anti-homosexuality law, which came into force in 2014, and then was as Richard said, was revoked on a technicality by the Constitutional Court about 6 months later, in August of 2014, did not stand as the abiding law in Uganda from that point on. But the damage had been done. So there was tremendous fear and continuing incitement. Scott Lively played an active part in that ongoing set of discussions. And now this 2023 law that has just been put into force with Museveni again reelected as the president, and now with a robust term ahead of him, is something that is likely to whip up a real firestorm. And in 2019, I was asked by a lawyer in New York in an asylum case to see if I could submit a brief where she was suing the state of New York and the various authorities that undertook to permit asylum. She was defending a young man from Uganda who had fled after really, he lived in the countryside, not in the city, but brutal harassment from his school, from his community. His father protected them, and at great risk to the father managed to get him to into Kampala, where he could get on a flight and come to the United States. The family pauperized itself to pay for his travel, and he just landed exhausted, penniless, with insufficient documents because he didn't have time to get them at LaGuardia Airport, and was denied entry by the U.S. Government at the time. He put himself at their mercy. And fortunately, this lawyer wrote a very good brief. I helped support it. And fortunately, the US court system allowed this man entry, which was unusual. And as far as I know, he has slipped into the United States and is now more free and less afraid. But in that period, which I looked at very closely between the 2014 enactment of the law and then when it was then 6 months later vitiated by the court, the amount of hostility, active hostility, verbal hostility, and invasion of the countryside as well as the cities by the authorities, religious leaders, and others who were currying favor to be part of the political system. The amount of abuse against the gay community intensified greatly. And so what we're looking at now, as has already been said by our two experts who are living this now, the intensification of hate crime, hate speech, hate abuse, and capture, torture, and perhaps death really has risen in this last 10 days. And it is a terrifying prospect from my perspective, looking at what Uganda has been through and anticipating that there are not going to be many checks and balances against the authorities at all levels.
Thank you so much, Jennifer. It's really a terrifying and chilling story that you're sharing. And I think, we're getting tremendous questions in the Q&A, and I'd like to turn those over to you all, because I think one of the critical things that I think many of us are here on the call are wondering is how can people help? And I think, people want to be good allies. And I think at many levels, there's questions about individual acts. And then, of course, our government, since the US government is heavily invested in supporting the health and well-being of Ugandans. So maybe let me go back to Richard for a minute, if I may, and hear from you, Richard. In your role, what do you think might be critical acts for us outside of Uganda, for allies around the world who want to support the incredible bravery you are sharing with all of us, and also the lives and well-being of the LGBTQI community?
Thank you so much, Ingrid. I must say, as a community, partners and allies in Uganda, we formed the Convening for Equality, the CFE. And under this, we are having strategies where we are responding jointly as a community, but also as partners. So it will be really important to support the initiatives of CFE, but also supporting the individual organizational work so that we do not lose any element because we are only concentrating on the law. And I think the other role of partners would be really to ensure that they work in consultation with the local activists so that we don't do or nothing is done that will put the community at risk or that could actually result into backlash. So again, it's really important, really coordinating and engaging the communities. When it comes to the US government, I think one and our CFE or Convening for Equality have been very clear. We do not believe in sanctions or cutting of aid, because at the end of the day, this again has a very negative impact on other Ugandans. And this is why we have said there's a need for having dialogue and conversations, but also finding ways of ensuring that the funding that comes to the country is channeled in ways that the communities that are targeted are actually receiving that support. And I think, again, this is why we've been working closely with PEPFAR, because as you all know, the head of PEPFAR, Ambassador Kingston, did issue communication to the country team of PEPFAR, notifying them that would not have the approval discussions as early as April until the government came up with a clear plan on how LGBT and other marginalized populations will be able to access services that PEPFAR is supporting. So such initiatives are really strongly welcome. And I think it's also really having dialogue. But I also must say that currently we have challenged, we've gone to the Constitutional Court. So the need of supporting the legal work that we are doing is really important. Right now, as Convening for Equality, we are supporting 2 petitions in the Constitutional Court. And again, we also know that another Ugandan lawyer who also an advocate also did present another challenge. So currently we have 3 petitions in the Constitutional Court. We are waiting to hear when we can have that. So again, these are some of the initiatives that we can be able to support and also look at. But most importantly, I think really having direct dialogue and conversations with the activists before any action is taken is really important.
Thank you so much, Richard. I want to go back to something that you are saying right now about these challenges that you're putting forward. And maybe I'll go back to Jennifer just for a minute, given her expertise in the legal process, and just to kind of inquire a bit more about that process, particularly within Uganda. I know that you were involved kind of looking at this from an international level, but within Uganda, are there ways that Ugandans, it sounds like there are ways that people are petitioning, but in your experience, given your vast expertise in this area, are there ways that people outside of Uganda can be supporting these legal efforts that Ugandans are mobilizing?
I think, thank you, Ingrid. My expertise is not vast. It's kind of narrow and focused in this realm. And I am not in any means an authority on healthcare issues in Uganda, other than being a public health doctor and very interested in some of these issues as it affects societies. So with that caveat, I would say that this is a really delicate time for the outside world to put immense pressure on Uganda. Part of the problem has been that there is within Uganda, and fueling the animus against gays, is the sense that this is a disease that of the mind and the spirit that has been inculcated by foreign influences, that this is undermining the integrity of the African family and the African project, however the leaders would conceive it. And it's ironic in that Scott Lively is one of the major philosophes and agitators. I mean, he certainly comes from outside, but he has infiltrated the religious community in Uganda, so that there's, I know there is disagreement within the religious community in Uganda against this hostility towards homosexuals, but and the entire community. But the outside pressure, as we just heard from Richard, and I would bet Kenneth agrees, is going to backfire and and put a harsher light on this community that is already considered culturally and politically transgressive. So that, but the problem is that the help that is wanted is, I would bet, likely to be funding or expertise done quietly through modes that Kenneth and Richard can identify. And many people on this call may already know that, these modes. There needs to be support, money, and other sorts of pressures perhaps, but persuasive techniques that the international community could use, but delicately within Uganda, because Uganda is very friable. I mean, it's beset by so many problems, not just this one that we're talking about today, that I fear this is going to be a very long struggle, but definitely financial support for the legal system, financial support for the health system is going to be extremely important for leaders like Kenneth and Richard to help organize and then communicate to a large community of people, I think, outside the country who would really like to help.
Thank you for that, Jennifer. I think that's so well stated and really speaks to the nuance of this incredibly challenging time. I want to go back to you, Kenneth, because I think a lot of people are trying to really understand there's a bit of a difference from what you're sharing with us, you know, really on the ground perspectives and what they may be reading in newspapers or seeing on television. I wonder if you might be able to share a bit more about particularly both members of the LGBTQI community who are trying to access care and what that experience is like for them, but also if you have knowledge of, you mentioned people who are trying to provide services, and how are they keeping safe? And are people feeling safe to be living in Uganda during these times? I think that would be very helpful for our audience, because a lot of people are asking about that.
Yeah, thanks, Ingrid, and thanks for the participants that are asking those questions. Of course, it's a very tricky situation and very fragile and very tense, actually. We don't know what to expect. We are living in uncertain times, and traditionally, of course, it's a community that has been harassed by the public, by security agencies. Luckily now, it's not so much by the security agencies, but what's more concerning now is the communities that the LGBTI live. That's putting them more at risk, because communities or the public is being more radicalized, and they're all getting agitated. They're all charged, and it's really concerning, to be frank. And yeah, it's a situation not anyone would want to be in. Yeah, but that's all I can say for now.
Thank you, Kenneth. I wonder, I think the concern that's also been raised is this is having a ripple effect in the region. And we see similar language to the AHA in other countries. Richard mentioned this, Kenya and other neighboring countries around Uganda. And I wonder how that's playing out within Uganda. Are people discussing this? And what are your thoughts? Maybe I'll go back to you, Richard, around the ripple effect throughout the region, that this is not just Uganda specific, but that this is actually occurring. And perhaps also if you might speak to the fact that if people are considering leaving the country for their safety, where is it really safe for people to consider going?
Thanks so much, Ingrid. And you conclude with a very tough point which, on that particular question. So really, with the Anti-Homosexuality Act in Uganda, we've seen that it always spills over into the region. When it was passed in 2013, 2014, there were discussions in Kenya of trying to table, but it was successfully pushed out by Parliament because it did not pass the test of human rights. And so we've again seen this particular time where another member of Parliament has tried. Actually, they've even shared the legislation. They've been changing it over and over, but you really see that the template and the language in terms of how they define terms and all, it's all related. We've seen the same in Ghana, which has been also really been discussed. And again, if you look at the language and the text, it's the same. And I also want to introduce and say that there is something that we also need to really be speaking out, is that a lot of persecution of LGBT people is happening in Tanzania. And right now, learning from activists and colleagues, we know that around 4 people have been sentenced to 30 years in jail because of homosexuality. And this is something that we are not hearing about in many places. They are in discussion. So again, the impact is really high here. We've seen the same happening in Burundi, where around 2 months ago, around 60 activists were arrested. So this is something that we need to really pay much attention, and it's actually cutting across the region. And I think this is why when we are discussing these ripple effects, we need to start looking at how do we ensure that protection of communities across Africa and other parts? And I know, for example, in the US, you're dealing with over 100 or plus legislation that are taking out the rights of LGBT persons, especially trans people. So this is an issue that we really need to take seriously and start having conversations and try to understand why are we getting to a level of even places that seemed as progressive, we are seeing a turn back. So I think this is really important. In regards to where people can seek refuge, again, seeking asylum is a personal decision. As an activist and as a Ugandan, my heart and hope would be everyone to be safe back at home, because there is no place like home. And again, this is my hope and prayer. But unfortunately, the reality that we find ourselves right now, that's not it. And people are trying to look for safety elsewhere. And again, this, I think I call up upon the international community when LGBTI Ugandans or other parts of the world where they feel persecuted, reach out on your doorsteps. Please open your doors and welcome them, because the protection is needed. I know last week we saw an announcement from the Canadian Prime Minister indicating a full support for Rainbow Railroad, where this civil society organization that has been working tirelessly in providing support for LGBT individuals across the world who seek refuge. And now the Canadian government has said they're going to work with Rainbow Railroad to ensure that people get a safe passage into Canada. And I really hope that other governments can do that so that LGBT people across the world are protected. But again, like I said, as a Ugandan, I would always hope that we will wake up to a moment whereby we're all appreciated and we do not have legislation that takes our rights because we are different or love differently, or because we are not part of what they're taking as a popular kind of thinking. And I think that's what we should all be working towards, to ensure that there's protection wherever we are.
Richard, those words are so critical and so appreciated. I want to acknowledge we have only about 5 minutes left. So I thought maybe what I would ask each of our panelists to do, and maybe I'll start with you, Jennifer, and go to Kenneth and Richard to close us out, is just to offer up closing remarks. And particularly, again, I think we have an incredibly active and engaged audience here today, and we're grateful for everyone's participation, just really important and critical questions. I think if there are thoughts that you want to make sure that you share, again, either around allyship or, again, I think, Jennifer, I think about you when you think about big regions. I mean, this isn't just Uganda specific. Are there things that we should be carrying away from this conversation to be aware of as we're moving forward over these next weeks, months, years, to be thoughtful and engaged as allies living globally? I'll pass it back to you, Jennifer, maybe to start us off.
Okay, well, thank you, Ingrid. And it is very, very essential to hear from Richard and Kenneth in terms of their perspective. Large parts of Africa are undergoing tremendous stress and strain for different reasons. And societies that feel under threat, populations that feel under threat, always tend to search for people that they can stigmatize as scapegoats and as reasons for their difficulties. So it is not unusual for the LGBTQI community to come under scrutiny in times of stress. In societies that have a reasonable rule of law, a disciplined police force, elements of the judiciary that are empathetic, and a balanced press, to some extent balanced press, there is safety in getting the word out and protesting against oppression and assault based on the laws that exist in the land. Uganda is at at the edge of the extreme, because this law now exists. There is a buildup of viciousness in some parts of the society against the LGBTQI community that dates back 20 years. The Ugandan government is stressed for many, many different reasons. And the way of controlling and creating unity among different communities in settings of various wars and huge refugee flows coming into Uganda and border disputes. I mean, the country is experiencing a great deal of stress. So that's why I think a really firm international policy opposing what's going on in Uganda, ways in which pressure can be put on the government that are not public, but are quite effective, targeted against what the government and the good people in government really want to have happen. That's important. That's not in my wheelhouse, but I know that these are where meetings at, discussions at diplomatic meetings around Africa and elsewhere can be very useful. Identification of where people can send money to support some of these brave organizations that's represented here. And then a really open asylum process. I mean, I think what Canada's doing is wonderful. The US should do this. Countries in Europe should do this. I know this is bleeding some of the best and the brightest who are at very high risk from Uganda. I know this is not what the activists within Uganda would really want, but it is a way to create some safety for those that are most outspoken, because it is very dangerous in Uganda. So I'm trying to sum up: soft diplomacy, change in border entry rules, funding that gets to the grassroots in healthcare and in sort of social support and human rights groups in Uganda who are alive and so far managing. This is going to be a long haul. So we have to stay focused and supportive and committed.
Thank you so much, Jennifer. Deeply, deeply profound. Kenneth, could I call upon you to give us your closing thoughts?
Thank you. I think mine is basically the right to health and the right to life. To me, they are inalienable human rights that everyone deserves, and those should be respected.
Thank you. And Richard, do you mind closing us out for this session?
Thank you so much, Ingrid, and my colleagues who have shared a wonderful time. And thanks so much to all the participants for the wonderful questions, but the engaging conversations. I must say that we find ourselves at a crossroads at a time when communities' lives are at risk. But I also want to say that the community in Uganda is resilient, just as it is across the globe. And I think in whatever way we can, we should be supporting communities that are fighting for their lives and their rights. This could be in the academia. I think we need to have more studies that really showcase the risks and the dangers of such laws like the Anti-Homosexuality Bill 2023, but also really providing methods in which communities can continuously access services. And I think these tools are available, but I think the tap and support from everyone is very key here. And I think we should never stop talking about injustice. And again, you don't have to be a politician, but even in your small ways, I think in your classroom, I think at your place of work, even when you are watching a soccer match or football, I think passing a message of equality, of love is very important, because there's already a lot of hate out there. And I think this is why we're resulting into such legislations that are targeting individuals like myself and thousands across the globe, and in Uganda in particular. So let's share some love. And I think let's speak out. Let's not keep quiet. We should speak out. Thank you so much.
Thank you so much, really, for your incredible bravery. Thank you all so much for speaking with us today. And thank you to our wonderful attendees who have superb questions. As stated, this will be up online on the Harvard Global Health Institute YouTube site if you would like to share it with others. Thank you, stay safe, and we wish you all well. Have a good day, everyone.